Let's see if this is working this time. Can't see it. All right. Oh, hey. So I guess it is working. You know, I've been trying to connect for a while now, and it was not working for me. And it seems that now it's working, right? So I saw a comment, so I'm just gonna take it as it's working now. Can you guys see me and hear me okay? Just comment if you can, so I'm aware that you guys can hear me and I'm able to see your comments. Perfect. All righty. All right, perfect. So finally it's working because I've been trying for a while. I'm like, all right, I tried it in my phone first and well with the computer, and it's not, doesn't look the same way, but whatever. Let's try this out, all right? So I'm just gonna see, wait a little bit and see if anyone else wants to connect. If not, we'll just get started. My name is Lali, if you don't know me, and I am a nurse. And today I want to have any questions. If you guys are students or you are thinking of becoming a nurse, and you have any questions, you're welcome to ask me. And I'll just said that there was like interruption or something. So if you guys can't, let me know. Alrighty, let me see if I'm able to check my phone as well. For some reason, I don't see it in my channel. Alright, so I can't. So whomever is connected now, if you do have any questions in regards of nursing or the NCLEX, I know the big NCLEX, you are welcome to ask me now. I just basically, this live was for that, basically, to see if anyone had any questions so I could help them out. I am here to help if I'm able to, all right? So I see comments or a question. It says, I'm taking my NCLEX next month. I've been watching your videos and finishing them. Really helpful. Oh, thank you. I'm so happy that they've been helpful for you because that's what I want. That's the reason I've been making these videos, and that's the reason I started like doing more like NCLEX and nursing videos, because I really do want to help you guys out. Like I said, I failed the first time, and I have no shame in saying it. I failed the first time, and I know why. And I know why I failed. And if you've seen my videos before, I'm open about why I think I failed. You know, like I have nothing to hide. So I did not study enough. I was just like thinking, oh, I got this. I'm gonna pass because I'm a good test taker, and it didn't work for me. It didn't work at all. So I'm open about that. And the second time I passed, and did the first time that I failed, and what I did the second time that I passed, that I was like, okay, I know what, I know what works now, and I know what didn't work. So that was very helpful for me. And I was like, you know what? I want to like share what I learned, and I want others to know what they shouldn't do before they go and take their NCLEX, because if they do these things, they might not pass the NCLEX. Hi, I see that someone just connected. And yeah, so basically that's it. I think that, well, for the person that commented, Melanin Queen, you, if you've been studying and if you know what you know, just calm down, just try to relax, and you got this. You, like I said in one of my videos, you are your worst enemy, because I know how you feel. I know you feel like you're going to fail. You're like, this is gonna be hard. I don't know if I'm gonna be able to do this, because I felt like that the first and the second time. I felt the same way that both times I felt like I was going to fail. And I was able to pass the second time. But you know what? The first time that I took my NCLEX, I was a little bit more confident. Like I was like, oh, yeah, maybe I'm going to like pass this test. Like even though I had 3 days to study, 3 days. Like I don't even know what I was thinking. But I was like, I could do this. I'm gonna pass this test. And at the end, when I left the testing site, I was like, ugh, it went all the way up to 130. So I kind of like knew I didn't pass it, but at the same time, I was like, maybe I'm gonna pass this test. And then I failed. So, and then the second time I had a nervous breakdown. Like I was just like, like I was crying. I couldn't move my car for like almost 30 minutes. I was literally in the testing site for almost 30 minutes, just like crying, shaking, because I was like, I failed. This is my second time. I don't want to have to take this test again. And then I passed. So you never know what's going to happen. You just have to like try to stay positive and just kind of like go in, and you got this. I hope you feel that you are prepared, Miss Queen, and just go for it. All right. Have you been studying? What you've been using to study? If you want to share that with us. And if anyone else has any questions or any comments, you guys are more than welcome to ask now, because basically this live was for that, just to kind of like answer questions and talk about nursing and and the NCLEX and whatever you guys want to talk about in regards of nursing, because I've been in nursing for a while now. I used to be an LPN, so that's how I started as a nurse. So I've never, I was an LPN for 5 years, like almost 5 years now. And then I graduated with my RN. So I've been in healthcare for a while now. So I've been using UWorld and also borrow Kaplan. Oh yeah, the Kaplan. I love that book. I love that book. I really do. And I feel that helped me. The book help me more in breaking down the questions. It really do. It really does. Like it helps you a lot on that. Because I use that. Like their techniques, that's what I was using when I was taking my test. The techniques that are in the Kaplan book, that's all I use. When I was taking the test, I was breaking down the questions using their techniques. So that book is going to be really, really good for you. Okay, so with UWorld, the way I was using it, I mean, like I always say, not everybody works the same way, and not everybody learns the same way. But with UWorld, the way I was doing it, I think I was just choosing questions. Like I wasn't even doing certain types of questions, because I feel like if you just focus in one type of questions, then basically that's everything you're going to be studying off. So if you do, I used to do like 50 questions, just choose 50 questions and choose all the system and all. You know how I forgot where were the other categories, but I used to choose 50 questions or whatever you wanted to study off that day, set the 75 if you wanted to do the 75, whatever you had time to do. I would do that amount of questions, and then after that, I would do all and all, and I will get all the different variety of questions. That way, you are studying off of everything. So you're not just focusing in one thing. To me, that worked best for me, because I was able to see all different forms of questions. Sometimes, like if I felt a little weak in a certain question, I don't know, in a certain category, let's say delegating or whatever. So I would just get maybe 20 questions of that, just that, or 30 questions depending. But I wouldn't just focus in one topic. I don't think to me that wasn't the best way for me. The best way for me was just doing that, like kind of like doing all. And then once you do all, you're able to see which category you were kind of weak on, and then that way you'll be able to choose after you study of all for a while. You're like, wait, every time I take these delegation questions, I'm not doing good. So then you're like, okay, So I should study a little bit more on delegation. So then that's how I decided to do just like 20 or 30 questions just for whatever topic I was a little like not the best on. And I think that's, to me, that was the best way to study. I hope that might work for you, or if that makes sense to you, just let me know. But I think that could work. That might be a better way, because I know it's a little like once you go into you world, it's just like, what do I do now? And then you want to choose all these categories because you're like, oh, maybe I want to study this, or I should study that, or I'm not great on this. And then you just choose these categories instead of choosing the whole topics, because everything is there for you to use. So I like to do all the questions, all the topics, and then kind of like figure out which one did not work for you. Does that make sense? You think that's a good idea? That's how I did it, and it really worked for me. I loved UWorld. UWorld was amazing. I think that was perfect for me. It was really, really great to study off UWorld and the Kaplan, if I'm saying it correctly. I don't even know if I am. But I love that one too. The book, it was great. All right, perfect. I hope that works for you. Try that out for a little bit and see how it works. And if it does work for you, then just try to, that's a better way to like kind of like focus on certain questions, I think, you know? But definitely try that out. And follow me on Instagram if you haven't done so yet. Excuse me, I'm getting a coffee. I need some coffee. You guys are welcome to follow me on Instagram, and if you want to DM me, you're welcome to do that there. If you don't know my Instagram, I think I have posted it in some of my videos. It's just Nurse Lolly, at Nurse Lolly. So maybe I could write it down here so it could be in the stream. This is my Instagram. And questions you have, or oh hey, what should I do, or do you think I should do this? Whatever you think. And like I always say, that's what worked for me. Like I don't want you to feel like, oh wait, she told me to do this and it didn't work for me. I don't want that. I'm trying to help you. I'm just letting you know my techniques and the things that I did and that worked for me, and I'm sharing those. And if you are, like me, so maybe you'll be able to learn and understand certain things. All right. So let me just post my Insta. See if I'm able to. That's it, Nurse Lolly. That's my Instagram, and you can DM me there if you want to ask me anything like private, not in the live. You're welcome to do that as well. Okay. Okay, so how can I tell if I am ready to take the test? Um, to me, the way that you can tell that you're ready to take this test, the NCLEX is no joke. It's no just any test like the test that you were getting in school is totally different. I feel after I failed the first time, I literally studied for a month and a half. So I'm not telling you go and study a whole year because you don't need that. You really don't. But you need to make sure that you have the resources that you need to study. So don't just go and, I don't know, like study off your nursing school books, because that's not going to work. It's not just that studying of the nursing books, because it's not going to work. You already know what you know. You know the knowledge, the nursing knowledge, you already have that. Now you need to learn how to, how can I say this? Now you need to regular questions that you would get in a regular test at school. So I think once you understand the way of answering these questions, like I once again, I'm going to say, Kaplan, that book, it's really good. I don't know if anyone else that's watching this to me, it worked so well because it helps you how to like break down the questions. These questions, they're going to be, some of them might be like, I don't know, 3-4 rows of the question. And the actual questions is literally like 3 things. Like it's so different. The actual question is not and answer them. And sometimes like the question is asking the opposite thing. So maybe you're thinking, oh, it's asking about, let me see if I could think of an example. Uh the expectation of something. So you're thinking, okay, it's asking me what should I expect if I were to do this. but the questions is asking, I don't want to like actually mention a question. That's why I'm just trying to give you little things. But um, you just have to understand how to answer the questions. If you feel you're ready and you use resources, if I don't know if you've been watching my videos, if you have, there's the video that I put out that says pass the NCLEX in 60 questions, I think. That's the one that has the resources that I use when I pass my NCLEX. If you haven't watched that video yet, I would recommend you for you to watch it because I show all of the different resources that I use and that work for me. So what I would tell you is once you study, you feel like you study enough, and once you have the resources to study off, because like I said, the first time I literally had 3 days. That's all I had, 3 days to study. Obviously I was not going to get ready in 3 days, so I didn't pass. So what I would say is once you know you have the resources, then after that I actually got UWorld, I got my Kaplan book, and I think those were the main things. I also listened to Mark Klemick book audios, and all of that was very helpful for me to like actually get ready for the NCLEX. So I don't think it's ever like, oh, you'll be ready in 2 months. Like I can't tell you you'll be ready in 1 month, you'll be ready in 2 or 3. It depends how you study and if you have the time to study, because like I also mentioned in one of my videos, it's to study, I feel like you need at least like once I really like threw myself out there to study, I was doing like 3 hours a day. So for almost a month, I was doing 3 hours a day of studying. So if you don't have that right now, like me, I'm a mom. I have 3 kids and a husband. Their husbands are almost like kids, right? So I have 4 kids, and it's hard. It's a lot. So and I have my job. So I was working. I'm working a full time job as an LPN. I was, now I'm an RN, but I was working a full-time job as an LPN. I have my 3 kids, my husband, my house to take care of. Like I had a lot going on, and I still tried to manage to do those 3 hours. So, and it was hard. It was hard. But if you do not have the time right now, if you're only able to do 2 hours a day or an hour a day, which I don't recommend, less than an hour, I wouldn't recommend if you're like almost ready to take the test. But if you're now, but it all depends. So hopefully you have the resources and you'll be ready to test soon, because I know you're eager to become that RN that you know you will be. Let me see if there's any other questions. All right, so I see very helpful doing your test for the first time. Did it give you advantage for the second time around? Yes, definitely it did. Taking the test that first time, it gave me a huge advantage because then I was able to see what to expect. But let me tell you this. When I took the test the first time, all the questions that I got the first time, I had there were like I had I had a lot of like variety. That's what I want to say. Like it was like a lot of different questions. I had a lot of select all that apply. I had just like regular multiple choice questions, but I had also the different types of questions, like the drop downs and the things like the one that to move over. I had like put it in order. I had a lot of those. I had like everything, a little bit of everything. But for the second time around, all I had was select all that apply and multiple choice. And the focus was more on, I would say, like delegation and priority. That was like the focus. That was like the main thing. No, I had like all over different questions. So, and different sort of questions, like the type of questions, like I said, the drop down and all of those things. I had everything for this. I, I even had math. And the second time around, I had no math. I couldn't believe it. It was literally like God was looking over me, because I was like, what? Like like at one point I was like, I think that's why I thought I failed, because all the questions that I got, it was totally different, and I wasn't expecting that. And it was funny because when I took my test the second, so I didn't took my break. The computer like gave me the pop up for me to take the break. But I said, no, I want to keep going because I felt like it was going to stop eventually. I didn't think I was going to go all the way to 130 questions. So I was like, this is going to stop soon. So I'm not going to take my break. And I didn't. So for my second time around, I was like, I had a plan. My plan was at 65 questions, I'm going to relax and I want to take my break at 65 questions. So when it stopped at 60, I was like, what is going on? Like, I was like, no, wait. Like, how did this stop at 60? Like, I need my break. Like, I needed to stop at 65 for me in order for me to take my break. So what is going on? Like, I was just freaking out. And yeah, and I passed at 60. So it was just so crazy. But it wasn't like it was an advantage for me taking it the second time around because I kind of like knew what to expect in a way, but everything was completely different. The test was completely different. I didn't get no questions that were the same one from my first attempt, no questions. And everything, the layout and everything was totally different. So don't, if you have to take the test and you don't pass and then you have to take it again, don't think that the questions are going to be the same or you might get one the same. Maybe you do. Maybe you're lucky enough and you'll get one that is exactly the same one as one that you took, but most likely not because I didn't. And everything was totally different. But it was an advanced works. Yeah. How many resources do you think someone should study for the NCLEX? I feel I think like the resources that I mentioned in the video that I posted, the one that says pass the NCLEX in 60 questions, I think those are good. Like I don't think you should use more than 4. And 4, I think it might be a lot. I think if you're using UWorld and it's working for you and you have Kaplan, and maybe you listen to Mark Klemick and Truth. I use Mark Klemick and because my fellow nurses are like my friends. They told me, oh, it's very helpful, and it did help, and it is helpful. But I didn't listen to I wasn't like really listening to the audios every day, and I didn't listen to all of them. I just listened to the ones that I thought I might have some issues with, like the delegation, and I listened to the diabetes one, and I think I listened to the sight one. So those 3 were the ones that I kind of like listened to. And most of them I was just like in the car listening to it. Like I wasn't like, like if I was studying the Bible. Like I was, you know what I'm saying? Like I wasn't like really into it and like writing my notes. I didn't do that with the audios. So I don't know how you study and what's like the best way for you to study. But I in the way you learn. Like I mentioned in one of my videos, it's very important to know how you learn best because that will help you in choosing the right resource to use. So if you learn best by seeing things, I think UWorld is good because you can answer the questions and it also has pictures. So me, I'm a visual learner. So I think that's why UWorld to me works so good because I was able to see the question and answer my question. And then if it was wrong, it will give me all this information and it will give me a picture and things to click on. And I love that. That was perfect for me to study. So if you are like me and you like to see things, that will be a good resource for you. If you don't like to see things and you're not into that, you like to hear things, the audios will be great for you. And they're posted. That one was helpful too. But I think if you're like to listen to things, the Mark Klemick audios will be great for you. But it just depends. To me, those 2 things were the main things, the UWorld and the Kaplan, because the Kaplan helped me. The book, the prep, whatever it's called, Kaplan prep testing. I forgot what's the name of it, but that one was really, really helpful just in helping me how to break down the questions. It's not like to help, like, I mean, it has other things, but that's the main thing that I got from that book, how to answer the questions, how to break them down. And that was just so great for me that I was able to use it. I literally used it in all the questions. So I think it's It's really good. It's really, really, really good. I think that would help you with that. UWorld doesn't have that. So that's why I think if you have UWorld and if you have the Kaplan book and you're studying off those two things, those are to me were the main things that I use. So it all depends how you learn and how how you think it will be best for you to study. Because I keep getting like a drop down saying that the connection is not good. So I don't know if you guys still can hear me. If you still can, just let me know. If you still can hear me, just write a comment. Hmm. Yeah, but that was pretty much it. Oh, thank you so much. If you guys are like, I'm so glad that you guys are like learning and like really appreciate this. Give me some thumbs up. That would also help me. And if you haven't subscribed to my channel, please subscribe. I'm pretty sure you are. And I will continue to make videos about the NCLEX, and I will continue to make videos about an RN is. I'm very excited about that too. So I'll make a video about that too. I don't know if you guys are LPNs or ever been in, like if you are transitioning from LPN to RN. I'm also making videos about that, like how was my transition in regards of like being an LPN to an RN. I know some people just go straight to doing, they had like the background. And I think like if you weren't sure about like nursing, doing the LPN first, it's good because you kind of like get an idea how, nursing is, because being an LPN is really close to being an RN. Like, it's like you're a nurse. So I think it's really, really good also doing that. But if you're going straight to the RN, it's even better because you're going, up there just like in one step. You don't have to take that. You're skipping one step and you're just going up there. So that's really good. Thank you. And if you guys question, you're able to ask me any questions right now. I see that someone else joined. Um, And yeah, just any questions you guys have in regards of the NCLEX or nursing in general, I'm able to answer them. Nursing school, I did my RN. It was everything was online. It was Excelsior College. I'm not sure if you are familiar with that college. And I think it was great. It worked for me because with pregnant when I no, I had just had the baby when I graduated with my nursing. So I was pregnant during my nursing school. So imagine having two kids, two little ones, and being pregnant and having a husband too. So it's a lot. It was a lot. So I think doing it online, it was so like it was so good for me because I was able to balance out so many things. I was able to work because I know a lot of nurses or student nurses, they're not able to work. They have to do nursing school full time. If you're doing it like in person, it's really tough to work. It's really tough to work full time. I mean, some people are able to work part time. I have a friend right now. She's doing the RN, and she's having a hard time keeping up with her job. She actually had to go per diem because it's a lot. Like once you're doing nursing in person, I know it's a lot, and I'm thankful that I was able to do it online, and it was very flexible. It was very flexible. Um, yes, I do have a husband. Yes, a husband and three kids. So, yes, I have a whole big family. So the program was so it was mainly it was a year and a half. But with Excelsior College, the nursing program, it's only for people that are already in nursing school. Oh, I'm sorry. I'm listening to my daughter. She's crying, and I'm trying to like figure out what's going on. But no, it's for people that are in healthcare already. So if you are already in healthcare, if you are an LPN, like that was in my case, or if you are, I think, a paramedic too. Like, you have to be in healthcare in order to go to this college, or do it through Excelsior College. And then it actually lasted a year and a half, like the actual book, like stuff, like I say it, like the actual classes. It was a year and a half. Then after that, you have to do the clinical. So they don't have clinicals like regular schools that have clinicals every, I don't know, so often. With this school, the clinicals, it's a 3-day weekend. It was 4 hours to get there. So I had to go there and do a clinical. It was a 3-day clinical. It's based. They'll give you all the information if you are interested in going there. They'll give you a in these 3 days. They'll give you what you need to do. You'll actually be in a hospital. You'll have a real patient, and you have to follow whatever guidelines they have. They have, like, they're very strict with the guidelines, and you have to follow it by the book. Like, for example, when you wash your hands before seeing the patient, you need to wash your hands, right? You turn on the faucet, you're washing your hands, you dry your hands, you throw that paper towel away, and you grab another one, you turn off the faucet, and you throw that one. So, like, little things. Sometimes I usually just dry my hands, and with the same paper towel, just turn it off. No, you have to make sure that one, you throw it out, you grab another one, and you turn up. See, like, they're like very picky in how they want things done, but you have to get it done the way they want it for you to pass. So that's like so that was pretty much it. So the catch with that is sometimes you have to wait. There's a waiting list to actually do the clinical. So I was done in a year and a half, and then I had to wait a long time. So it wasn't even a long time. I think I was done in, let's say, I think it was the summer of last year. And then I waited, and I took the clinical, I took it in February, I think it was. So, I mean, it was a little bit of a long time, but some people have to wait even longer than that. So, so yeah. So it actually still, it took me, what, 2 years basically. I started in the fall of 2017. Oh, the NCLEX. So yeah, it takes, it could take, it depends, and it also depends on how you want to do it. Some people just want to do two classes at a time. You could do that if you think you could do it. I was doing one class at a time too. So it's also at your own pace how you want to do it. Like I said, I was like, I don't want to fail this. I really want to do this right. So I was doing, like, once I started doing the nursing classes, I was doing one at a time. Some people will do two if you're able to, three if you think you can do it. I was like, I cannot. I don't want to, like, mess this up. So I was just doing one at a time. So that's another thing. If you do it faster, then you could, end faster as well. Recommend it. I liked it. If you're interested in it, I'm gonna type the name of the college. It's called Excelsior College. If you can look into it and see, they have the nursing program. They have different things, but they have that nursing program, and it's good. I liked it. Some people don't like it. If that's not for you, then it's not for you. If you are like me, you're busy, you still want to work full time, because I was still able to work full time, which is something that I loved, because I was like, okay, I need to work. Like, I'm not just living with my mom. I'm not 18, 19. I'm older than that, and and I'm like, and I have a family. I have a husband. I have 3 kids. I need to have a full-time job. So I was still able to have my full-time job and do this. So if you are like me, then I think this could work for you. If you are able to actually do school and, like, actually go to school and do the nursing school, and that's better for you, then that go that route. But if you are busy, this might be a good choice for you. This live, I just wanted to answer any questions you guys may have. One more questions. Was prerequisite included or separate? Okay, so for the prereqs, I had already done them at another school, but if you don't, with me, I had them all, but my sciences were expired. The AMP 1 and 2, they were expired, so I had to redo those. So I was able to do it with them. So if that's your case, if you do have your prereqs and maybe you're missing a couple of things, then once they receive your transcripts from your all college that you did your prereqs in, they'll receive it, they'll go over everything, and they'll accept whatever they're going to accept. Whatever they don't, if you have to take it, then you'll just do better than what a better grade than when I did it at the other college. So that worked for me. Like I didn't mind doing it with them. It was really easy. Like not easy, but it was easier than actually doing it in the classroom when I did it. So I was able to get a better grade. So, but yeah, you do need prereqs, and also you need to do the TEAS test. Yeah, they require those things. Yeah, I think it was really good. I liked it. It worked so well for me. I was still able to work, and I was just, yeah, it was really good. Like to me, some people don't like it because, like I said, it depends your situation, and it depends what you really need or want at that moment. With me, I really needed to be able to work full time, and I really needed something that it was flexible, that I was able to just do it at my own time, basically. And this college was perfect for me. And actually, another thing, if you were to do this college, if you decide to do Excelsior College, another thing is that doing your clinic, like working, counts as your clinical, basically. So that's why you only do that 3-day weekend. So they gave me like a letter, like a page there, and that basically counts as clinical as well. So that's why they only have the 3-day weekend, because the other part basically is covered, because you working counts as clinical for them. So it kind of worked. Like I said, I did like it. I heard people say they don't like it. Some people don't like the fact that they have to do that 3-day weekend clinical, because it is tough. It's hard. It's hard doing that clinical. Like I said, it's a little bit, but if you study, they give you everything you need. They give you the instrument, basically. It's not like they're going to tell you, okay, they'll just throw you out there. No, they'll give you what you need, and then you just go over everything that you need to actually do, and make sure that you do every little thing, though. That's the catch there. You have to make sure that you do, like I said, with the hand washing. Who would have, like, like sometimes you don't really think to grab another paper towel, but you have to for this test. So like little things like that. But once you study, and it's good. I like it. If you guys have any other questions, you're welcome to ask now. Thank you so much for watching and staying tuned. I hope you guys stay tuned in my channel, and you're able to like watch more videos, because I will be having more videos coming up. Every Saturday I'll be having videos about nursing and the NCLEX. So every Saturday you'll get a video about the NCLEX or nursing. And like I said, you are welcome to DM me as well in Instagram. And if there's any video that you might want me to make, let me know. Like, I don't know, whatever you're thinking about. If you're like, oh, let me see if she can make a video about this, just send me a DM, and I might be able to make a video about it. And like I said, I just want to help you guys out. So thank you so much for watching. I hope you enjoyed this video. If there's no other questions, um, thank you very much. Very helpful. Oh, thank you. Thank you so much for watching. And so I don't see um yeah, the lectures are mandatory. Well, the way they do it is not like how was it? Everything it's online, and they'll give you what you need to do basically for that week. So it's not actually like at the lecture, like it's not actually a live thing that you're seeing a teach. Whatever you need to do that week, it's important that you do it that week. It's not like, oh, I have time to do it next week. No, they'll give you, okay, you have to do this thing this week. This is your homework to do, basically. So if you do it that week, then that's it. So, and I remember, I think every Sunday you get a quiz, and then every 4 Sunday you get a test. So that you will always at the end, after studying whatever you needed to do that week, you'll get a quick quiz, and then you'll get a test of like those 3 things that you kind of like went over. So yeah, you'll be testing a little bit, but it's not too crazy. Trust me, it wasn't, to me, it was good. And they don't give you a lot of stuff to do. Like I was able to, like I said, with my family situation things. Obviously, it's not like you're going to, it's not going to be easy, but it was really, it was good. It worked for me. So yeah, it is mandatory to do whatever you're assigned to do that week. It is mandatory to do it that week. You don't get the next week to do it, because the next week you'll get other things to do. So yeah, that's how it works with them. You guys don't have any other questions? I will be going to take care of my daughter. She's 10 months and she was crying, so my husband might be going crazy by now. So I'm gonna go and take care of her now. So thank you so much for watching. If you enjoy my channel, please share with your friends or your other future nurses out there. And yeah, stay tuned, okay? Kisses. God bless you guys. And good luck on your test. I know you are going to nail that test. You got this. You know what you know. Don't let that little thing inside there tell you that you can't do this, because you can. So don't let you, all right, mess you up, because don't let that happen. You got this. You're going to take this test. You study for this test. You had the resources you needed. You study for it, and you are going to pass. You get you afraid of this test, because you got this. So just relax. Listen to yourself, your inner self, and you got this, and I know you do, and you will pass this test. Okay. All right, guys. So bye. I'll see you next video. I'm not sure what the next video will be about, but like I said, every Saturday I'll be doing NCLEX videos and nursing. So, and I might do another live some other day, because I guess it seems like it worked and it was helpful for some of you guys. So I might do another live. Like I said, if you are on my Instagram, check me. Stay tuned, because I'll always post when. See you guys. See you next time. Kisses. Bye-bye. Stay tuned.